This 95th instaLecture would be on a query that you have asked me, that what is the correlation between the free erythrocyte protoporphyrin level, FEP level, and the iron deficiency anemia. The answer of this question is this, that obviously they are increased. FEP level is increased in iron deficiency anemia. But the more important question is why? Why they're increased in IDA. The concept is very simple. I would explain it in whiteboard also. But just go through few quick concepts which I would like to explain right now. What is RBC, red blood cell? It's a bag filled with hemoglobin. What is hemoglobin? Hem plus globin. Why anemia occurs in iron deficiency anemia? Answer is due to lack of iron, because it's iron deficiency. If there is problem in iron, lack of iron, why there is anemia? Simple, because iron is required to produce heme. So if heme is not produced, hemoglobin cannot be produced. So obviously that results in anemia. If you understand up to this, now it's very simple to explain why free erythrocyte protoporphyrin level is increased in iron deficiency anemia. If you remember the basic steps in the heme synthesis, the last step in heme synthesis is this, that protoporphyrin, free erythrocyte protoporphyrin or protoporphyrin 9, that binds with iron to form heme. So in a patient with iron deficiency anemia, they don't have any iron. If they don't have any iron, iron cannot bind with free erythrocyte protoporphyrin, protoporphyrin 9. So what would happen to protoporphyrin 9? Their level would increase because there is no iron to bind with it to form the heme synthesis. So as heme synthesis does not occurring due to lack of iron, obviously that would result in lack of heme, lack of hemoglobin. And as a result also, there's due to the lack of hemoglobin, as there is not enough hemoglobin to put inside that bag, the RBC size would also become smaller, that is microcytic, and they would become less red because hemoglobin imparts the red color. That would become hypochromic. Hypo means less, chromic means color. So the question itself is simple to understand. I would again explain it in the whiteboard, that you need to understand why FEP level increases in the case of iron deficiency anemia. It's a very simple concept actually. So in the heme synthesis, hemoglobin is equal to heme plus globin. And in heme synthesis, the last step is it requires free erythrocyte protoporphyrin. That means FEP or protoporphyrin 9 or FEP, which binds with iron to form heme. So now the problem in iron deficiency anemia that you don't have iron, you're lacking iron. So what would happen to this protoporphyrin 9 level, which is FEP, free erythrocyte protoporphyrin? Their level would increase because there is no one to bind with them. So their level would increase. And that's why we get higher level of free erythrocyte protoporphyrin in the iron deficiency anemia. Another bonus concept which I like to mention here, that in lead poisoning also, free erythrocyte protoporphyrin level could be increased. The concept is also simple, very simple here. Basically, this protoporphyrin and iron, it becomes heme with the help of an enzyme. The name of this enzyme is ferrochelatase. So in this step, an enzyme is required that is called ferrochelatase. And this ferrochelatase enzyme is again inhibited by lead. So when you have lead poisoning, this enzyme would be inhibited in the lead poisoning. And obviously that net result would be protoporphyrin level would also increase because protoporphyrin cannot bind with iron to form the heme. So these two conditions where we primarily get free erythrocyte protoporphyrin. And in some places, some studies they have done actually that they use this FEP level for pediatric low-cost screening for iron deficiency anemia, and it's also used for lead poisoning, this free erythrocyte protoporphyrin. So in summary, what we learned that in iron deficiency, free erythrocyte protoporphyrin level would be increased, and that would be increased because due to lack of iron, protoporphyrin 9 cannot bind with iron to form heme. And as they cannot bind with iron to form heme. So obviously the level of protoporphyrin 9 or free erythrocyte protoporphyrin level would increase because they cannot bind with iron because iron is not there in iron deficiency anemia. And in lead poisoning also, this FEP level would be increased, but due to a different reason, because lead inhibits the enzyme ferrochelatase, which actually helps to act on protoporphyrin 9 and iron to form heme. So if the ferrochelatase is not there, again the same problem would occur. Protoporphyrin 9 cannot bind with iron, and the protoporphyrin 9 or free erythrocyte protoporphyrin level will be increased. So that's all for this session. Actually, it's a brief session as you have asked, and I hope this helps to resolve your query that why protoporphyrin level is increased in the iron deficiency anemia. Thank you so much for attending the session. Have a nice day.